Welcome back to AM Northwest. You know, we've heard a lot over the past few years about the importance of cultivating better gut health. But did you know what's happening in your gastrointestinal tract could also be impacting your brain? Here to share more about the link between gut health and depression, along with what we can do to boost our mood, we welcome back the author of The Prime, Dr. Kulreet Chaudhary. Good to have you with us, doctor. So let's talk about this. Yeah, let's talk about the link between mood and gut health. And is this a new idea?
It's not, but you know how we're always kind of coming back to wisdom that our parents and our grandparents and our great-grandparents knew? This is the same. This has been known for thousands and thousands of years, but science is finally proving that yes, in fact, if you want a healthy mood, you have to think about what's going on in your gut.
So is modern medicine then confirming this idea, this link?
We can say that modern medical science. Now, the challenge with modern medicine is sometimes it takes 2 to 3 decades from the time that we actually know something's true for it to be taught in medical schools. And so even though modern science is seeing a link between the type of bacteria and other organisms that live in your gut and the thoughts that you're thinking and the mood that you're experiencing in your mind, it's still going to take doctors a few decades possibly to learn this in their medical training, and that's really unfortunate.
So can you attack these issues separately and successfully? So gut health maybe? No.
No, and that's, it breaks my heart because I see patients that are really trying hard and they're on a list of supplements for mood and they're trying to do everything they can that they've researched, to improve their mood, but they're barely treading water. Even when you do absolutely everything for your brain, you're barely treading water. And that's because half the solution is in your gut. And honestly, Helen, that's the easiest part of the solution.
Okay, so then how do we do that? How do we change what's going on in our gut? And also, I have to say, a lot of people right now here in the Portland area, we're really depressed because of this weather. I mean, seriously depressed. So it's like, how do you see optimism in all of this?
It's simple because a lot of the source of optimism comes in your gut. And what I mean by that is the majority of serotonin, which is your feel-good neurotransmitter that actually helps to fight depression, is made by the bacteria in your GI tract, not coming from your brain. So when you can first just kind of understand that, okay, hold on, there's a huge part of my neurochemistry that stems from my gut, then you realize like, oh, this is an untapped source. So some simple things that I do, there's an Ayurvedic herb, and Ayurveda is the ancient medical system in India that talked about this for thousands and thousands of years. There's an Ayurvedic herb called Triphala, which is absolutely amazing for your gut. And it's one of the first things that I start every single one of my patients on for that reason.
And then also you talk about meditations and mantras.
Absolutely. And it's not that meditation is not important, but when you are doing meditation and working on your gut simultaneously, what you're getting is double the benefit. You're dealing with the signals in your mind that are also impacting your gut negatively. Depressed mood also impacts your gut negatively, but then at the same time, you're working specifically on doing interventions like Triphala that are also helping your gut health.
Okay, so tell me about how you come up with a mantra.
Well, you don't have to come up with a mantra. The nice thing about a mantra, it's, you might be thinking of an affirmation, which is very different from a mantra. Okay. A mantra is just a sound. It's a sound that has no meaning. Most people will have heard of the mantra Om.
Right.
And it's because it's a sound that has no meaning. There's a specific mantra that I give to my patients who are struggling with depression in particular, and it's simply Om Aim Namaha. Om Aim Namaha. Now, if you look at any one of those sounds, they don't mean anything individually, but the sound vibration of all of that together has a way of making your brain waves fire in a way that is more resilient to a depressed mood.
So what is the fastest way then to shift mood using the techniques that you just talked about?
Using all of them together, starting a meditation practice, looking at herbs that help to improve gut health, looking at your diet. If you're really struggling with mood, taking an honest look at the foods you're eating. And I love giving a recipe for my prime tea. It's just cumin, coriander, and fennel seeds, just a 1/4 teaspoon of each. You boil it in 4 to 5 cups of water for 5 minutes and drain out the seeds, drink it all day long. It is such a simple thing to do, and it boosts your mood immediately.
What do you suggest to people who, like, what are some lifestyle choices you think they should make when it comes to improving their gut health?
Well, there's some really simple things that don't even involve changing anything you eat, like making your largest meal at lunchtime. So I'm not even saying change what you eat. I'm just saying if you're eating the largest meal at dinner, change it over to lunchtime. And again, not changing anything you're eating, but don't eat after the sun sets, or in places where the sun sets really early, don't eat after 6 p.m. These are simple lifestyle changes that directly impact your gut health, and they're not asking you to change what you eat.
Right.
Just simply asking you to change when you eat them.
Right. Makes a lot of sense. We want to tell everyone the book again is titled The Prime. Dr. Chaudhary, thank you so much. I appreciate it.
It's my pleasure.